everyone. So I'm very pleased to give this talk about new data from DAR survey 2020 and 2022. And the topic of my presentation is about the smoking and the high blood pressure if they are challenging for fasting. So first of all, what we know that individuals with pre-existing diabetes could be at risk to fast Ramadan. But what about hypertension and other cardiovascular risks like smoking? So here in my presentation, I will have two parts. The first part is about hypertension. I will present the data of DAR, then something from our Ramadan research group from Tunisia. And then the second part is about the smoking. So here for the first part is about hypertension. So you can see here that we have about 3,000 patients who fasted Ramadan and they are hypertensive. And this group was compared with the normotensive population, that is about 7,000 patients. And we can see here for the characteristic of the population that we have more aged patients in the group that is not controlled. So just here to tell you that we divided the group to three parts. Patients that have the level of blood pressure between 130 and 140. The second group about 140 and 160, and then the patients that are not controlled at all, that have the systolic blood pressure over than 160. And you can see here among the age that the patients that are not controlled are more aged than the other group. So here we have the same level and the same percentage of patients in the group on fasting. There is no difference, and we have more patients with hypertension that want to fast during Shawwal after Ramadan. So here you can see the duration of diabetes and hypertension. So we have the same level, but when we compared here the patients with the duration, we can have the difference between the duration and the control of blood pressure. So then we divide the group into two groups. So the group with complication, the kidney complication and the cardiovascular disease complications, and we compare this with the non-chronic kidney disease or no cardiovascular disease. Of course, this is in the hypertensive group. You can see here that when we see the age, we have more patients that are complicated with renal complication or cardiovascular complication with patients with over than 60 years. And here, when we see then the gender, we have more female in hypertensive group. And for the smoking, we can see that there is no difference between the hypertensive group and the normotensive population. But here you can see the difference between them when we compare the ex-smoker, the smoker, and the no-smoker. And we can see here the difference when we compare this with the level of the blood pressure, if they are controlled or no controlled. So no difference for the A1C and hypertension during Ramadan. Here, when we see the medication, so we can see that we have more patients that are treated with insulin in patients that are not controlled for that their blood pressure. So as I told you, we have more complications in the patients that are not controlled for their blood pressure, and of course, when we have complication, we are treated more with insulin and several forms of insulin. So here, when we can compare the complications and the level of blood pressure, we can see that we have more retinopathy, and with a significant result, more retinopathy, especially in patients that are not controlled and with a high blood pressure more than 160 millimeters. So here there is really a positive correlation and a positive link between retinopathy and high level of blood pressure. So here for patients that have a complication like a CVD or a CKD, we can see that about 80% who fasted the month of Ramadan, and despite that, in the majority of times, and when we calculate the risk, we have patients with high risk to fast Ramadan, and despite our advices, the patients insist to fast, and we have this result in our data, and we have about 80% of these patients with complications that fasted Ramadan, compared with 93% of patients who they have not complication who fast Ramadan. So here, the same thing, we compare the patients with hypertension and with and without complications. And as I told you that we have more patients that are treated with insulin. We can see here the significant results. And for complications, we have more complications, the macrovascular complication like retinopathy and neuropathy, and the group who have the CKD and the CVD. So here, when we see and when we look for the complications, and we know we have two major complications, the hypoglycemia and the hyperglycemia, we can see here that we have for patients here for normal hypertensive, we have more frequent hyperglycemia with a significant result. And when we compare here the level of blood pressure with the complications, we can see here, for example, for patients who have hypertension with blood pressure more than 160, here we can see that this high level of blood pressure is associated with a high risk of hyperglycemia. Same thing for hospitalization. We have more emergency attendance for patients with high blood pressure. And of course, same thing with hypoglycemia. So when we see the total group, we have really not a big difference, but when we see in details, we have more patients who attend hospitalization and emergency for hyperglycemia or hypoglycemia with patients that they are not controlled for their blood pressure. So here, for the patients with complications, here in black, we can see that we have more patients that are complicated, that have the history of CKD or CVD, who attended emergency for hypoglycemia. And this could be very dangerous for these patients, diabetic patients with complications that are at high risk to fast. And you can see here this result with more complications and more hospitalization, especially for hypoglycemia. So for this reason, it's very important to assess before Ramadan, and we are in the true time to advise them to not to fast. So then this is another research is about our Tunisian Ramadan research group, and the question that we have is to see and to assess the effect of Ramadan here, the effect of Ramadan fasting on blood pressure variability. And it's really a rare trial. When we see the literature, we don't have a lot of studies like this. It's not yet published. And our question in our research group is to assess the effect of Ramadan fasting on blood pressure variability and its interference on endothelial function, and then to determine whether the effect of Ramadan fasting on blood pressure variability depends on baseline endothelial function. So here the method, we can see that we assess patient that we have the patient who is compared to himself. So we did a visit 6 months before Ramadan with a lot of things, with the monitoring of blood pressure, the endothelial function, and then in the first day of Ramadan, and then at 20 days after the beginning of Ramadan. And to assess the endothelial function, we use this method, non-invasive method that we use it. And here the results of our trial in Tunisia, we can see here that we have during Ramadan, we have more nocturnal hypertension. So we have a high level hypertension. And when we see the variability, we have more variability during Ramadan. And then we test this if there is a link between this and the endothelial dysfunction. And our results shows that Ramadan fasting significantly increases the variability of blood pressure, especially on the night. And Ramadan does not worsen the endothelial function in fasting subject, but if baseline endothelial function is impaired, fasting can increase the blood pressure variability and decrease the frequency of deeper hypertensive patients. So here it's a very interesting result, and we will publish these results in a few weeks. So then the second part is about the smoking, and the question is if tobacco disturbs fasting during Ramadan among diabetic patients who fast. And the goal of this analysis is to investigate baseline demographic, biochemical, and fasting characteristic of type 2 diabetes patients who participated in the DAR survey of 2020 and 2022. And when stratified based on their smoking habits, we have 3 groups: the current smokers, it can be cigarettes, it can be shisha, it can be vape, or ex-smokers, and non-smokers. So here we can see that we have about 400 current smoker, 600 ex-smokers, and about 5,000 no smokers. And of course, we have more male than female that are smoking. So we can see here if there is a difference between the fasting, the duration of fasting, or the intention for Shawwal fasting. You can see that there is no difference between the 3 groups. And then when we see the duration of diabetes, we can see here that we have more duration with the ex-smokers. So of course, the smokers who stopped smoking because one of complications like the CVT. So here we have more ex-smokers when we have a duration more than 20 years. So for the other characteristics, we don't have any difference between groups, the 3 groups, apart from the LDL. We have here more controlled LDL in patients who are not smoking. So it's logical finding. So then for the complications, so of course we have more complications here in this study when we are hypertensive. We have ex-smoker in hypertension, a positive link between hyperlipidemia, retinopathy, neuropathy, macroalbuminuria, nephropathy, macrovascular disease, and diabetic foot for a positive link between ex-smokers and all these complications. So as I told, of course, perhaps one of explanation is that there are some complications that maintain this stopping of smoking. So then when we see the hypoglycemia among patients who fasted, so here it was really perhaps a surprise, because we don't have a lot of patients who are current smokers who attended for hypoglycemia. We have more patients in a non-smoker group and ex-smoker group for hypoglycemia and hypoglycemia of with attending the department for this hypoglycemia. This was a significant result. And for the hyperglycemia, we have more hyperglycemia in non-smoker and in the ex-smoker than the current smoker. So here we should find an explanation between this finding. So for the conclusion, patients with diabetes and high cardiovascular risk, including hypertension and smoking, require special attention during Ramadan fasting. And the Tunisian Ramadan Research Group studies and DAR survey 2020 and 2022 have highlighted the significant link between this disease during Ramadan. Thank you for your attention.